Hi, this is Dr. Stella Desyatnikova. I'm a facial plastic surgeon in Seattle, in the United States, and it is my pleasure today to talk to you about how I use ultrasound to do ultrasound-guided injections of filler in my practice. Ultrasound is a large part of my practice. I use it for filler injections, for treatment of complications, hyaluronidase injections. So I'm going to share a little bit of my experience today and hopefully show you some anatomy, some areas that I think it is important to use. These are my disclosures. I'm a consultant for GE Healthcare, and also I teach my own facial ultrasound courses. So ultrasound plays a large role in our practice. It's a great tool for education. It's a great tool for education for early injectors to learn the anatomy, and also for more seasoned injections. And it's also can teach us about anatomy in our individual patients and about the individual variations. It can help us with precision and placing the filler, and certainly can make our injections safer. So we can map the blood vessels and avoid them so that we prevent the vascular occlusion and other complications. I use it for my consultations so that we can see the prior filler placements in the patient, especially permanent fillers and any surgical changes, in particular implant placement and any other changes, and then that can affect our treatment plan. And then, of course, we use it as a tool to do ultrasound-guided injections, filler, and also to treat the complications, usually with injections of hyaluronidase. We can use those guided injections to treat the vascular occlusion in a very precise and guided fashion. So a little bit of a problem with ultrasound, especially when you start, is that a lot of things can look the same. For example, many things will be black, and then many things will be white, and there's this gray in between. So when you're just starting, it can be a little bit confusing. So what I do usually, first of all, I show you with a diagram exactly where my probe is on the face and how it is positioned. So then it makes it easier for you to associate it with normal anatomical structures that I usually position in that area. And then let's cover a little bit of different tissues, echogenicity, which is ultrasound speak for how the tissues look on ultrasound. So on the one end of the spectrum, we have something that's anechoic, which will be totally black, and usually it will be water, it will be fluid, it will be blood in the blood vessels, and then it will be our hyaluronic acid gel or filler in this case, and then here is our ultrasound gel. And then on the opposite end of the spectrum, we have something that is hyperechoic, or that will appear white. And then in this case, it will be bone, dense fascial tissue. The lower reticular dermis can appear fairly white or hyperechoic. And then, of course, we see the white line of epidermis, which is reflective to the ultrasound waves because it needs the ultrasound gel of very different density medium. And then we still have the stuff in between. Then we can add the color Doppler or power Doppler. So in this case, it's a power, and you can see this yellow orange. Basically areas where there's motion. In this case, it's a motion of blood in the blood vessels. So this is how we find the blood vessels. So when we do the ultrasound guided injection, there's two ways basically that we can do it. And one is in plane, which is shown here. And it is when we orient the needle or cannula parallel to the midline of our foot plate. And then when we look at the image we usually see the whole needle or cannula on the screen, and it makes it easier for us to hold. And then the second method, or out of plane, which is shown here, and that's when the needle or cannula is perpendicular to the foot plate. So what we'll see on ultrasound is usually just a dot. And that can be a little bit more complex to understand and to learn, especially for younger injectors and the ones early in their ultrasound career. So we will stick today with the in-plane injections, which are shown here. So you can see the whole needle or cannula injecting the subcutaneous plane, subcutaneous fat. And you can see that our cannula in this case is oriented all along the midline of the foot plate. So the best areas for us to use this ultrasound guided filler is, first of all, areas that can be very high risk, and where we definitely want to avoid the blood vessels. And then, of course, they need to be areas that can be amenable to do those injections and somewhat reasonable for us to use this method. So we'll cover several areas today, but overall, we use it in the temples, we use it in the nose, in the area of the piriform aperture, in the midface or deep medial cheek fat, in the forehead, in glabella. And then there are some areas that I always use ultrasound guided injection, for example, in the forehead and in the temple during the interfascial plane, which I will show you later. And then there are some areas where a lot of times we just do the mapping first and just look for the blood vessels and then inject filler without the real-time ultrasound. So on the video that you saw here today, here we're injecting the deep medial cheek fat. And you can see there was filler, which is hypoechoic, very dark, filling this deep fat plane. So one of the areas that is nice to do the ultrasound guided injections of the filler is the temple. And the temple anatomy is fairly complicated. So this is what it looks like on ultrasound, and you can see the position of my probe here. So there's several layers of the fat where we usually like to inject the filler. And then there's several layers of the fascia. So this is an image out of my paper from a little while ago on actually ultrasound guided temporal filler injection. So we usually inject the filler either in the subcutaneous plane, which is here in yellow, or the interfascial plane, which is here in bright yellow. And this is between the superficial temporal fascia, which is in blue, and the deep temporal fascia, which is in green, the superficial layer of the deep temporal. And then occasionally we'll like to place filler on the bone, which usually ends up in the muscle here, in the temporalis muscle. And those usually we do the mapping, but my preferred plane is the interfascial plane, and we always do it ultrasound guided. So the risks of doing the filler injections in the temple area are fairly significant, and that's why it's nice to use ultrasound to prevent those risks and prevent the complications. And one of the main risks, of course, is vascular occlusion, either from occluding the superficial vessel, superficial temporal artery and vein, or the deep temporal arteries, or the middle temporal vein. And from the superficial arteries, you can get the skin necrosis or hair loss, which we hear quite a bit about now. And from the deep temporal arteries, you can actually get blindness, and you can actually get necrosis of the palate. And from occlusion of the middle temporal vein, which you can see here in this video, of theoretically injecting a bunch of filler accidentally into this vein and lead to pulmonary embolism. And then other risk of temporal injections, putting lumps of filler or putting a lot of filler superficially can lead to surface irregularity and cosmetic deformity, which is also undesirable. So here's a video from the article, and just show you a little bit how I do the temporal filler injections, in particular using ultrasound to do the injections in the interfascial plane. So we start usually with marking the borders of the temporal fossa, the superior and inferior border, and marking the lateral border of the orbit. We can pre-scan, looking for deeper superficial blood vessels. And then we use a cannula and place it on the deep temporal fascia. And then actually we use the ultrasound to confirm the position of the cannula in the proper plane. And we do it by injecting a small amount of filler, because it is a potential space. There is no real space in there. But once we start placing filler there, you can see that that plane actually expands. It's normally filled by the loose connective tissue and tiny amounts of the fat globule. So we can watch on the ultrasound and see how that plane expands and filled with filler. And then we can reorient the cannula in the band-like fashion, and then we can place additional threads of the filler. So here we see a close-up of this injection in the ultrasound screen, and you can see that we can watch the cannula and we can watch the filler coming out of the cannula, expanding that plane, and we can basically place as much filler as I think is needed to achieve the cosmetic correction. So here's the patient's before and after, and then what you can see here is the before, and here in the after we have temporalis muscle, and here we have this intermediate temporal fat, which I haven't mentioned yet, leave that alone. And here, this anechoic and hypoechoic basically plane of filler in the interfascial plane, and it is above the deep temporal fascia, and it is below the superficial temporal fascia. Exactly where we want it to be, and then we can see the nice correction on the patient. The other area that can be nice to use for this ultrasound guided injections, occasionally, not always, but occasionally, is a nose. So here we see the diagram and also the panoramic ultrasound view of the nose. Here's a sagittal view. This is a patient who had some filler, and here I marked it in the darker blue color. So, and here's the diagram, the anatomical diagram, and I marked in bright blue the areas where we usually place filler. So it's at the tip and in the radix, and frequently we put it at the base of the columella, at the nasal spine. Those are fairly common areas. So usually we use a needle and place those injections with a needle. And we can do the vascular mapping before, and actually I always do the vascular mapping before. But occasionally we see something like this. So for example, in this patient, when I looked in the radix, I saw the large arterial structure on both sides actually, close to the midline, and that's going straight through the bone and potentially directly connecting to the ophthalmic circulation. And then of course, we see the large intercanthal vein, and here's the dorsal nasal artery, all those large arterial structures in close proximity. exactly where we need to inject. And then in the tip, we also see the arterial structures in the midline and also above the nasal dome, the lower lateral cartilages, which is again where we normally like to place a structure. And then when I looked along the midline, there were more blood vessels along the midline. So we chose to do this ultrasound guided using the cannula, which usually works well for augmentation rhinoplasty, where we need to place a fairly large amount of filler along the midline. And obviously, when there are all these blood vessels, and using the cannula by itself in the nose, it's not necessarily the safest, and there have been multiple cases of blindness reported using cannula in the nose. So in this case, there's a cannula, and here again is a sagittal image of the cross section, and here's a video of the injection. And you can see that we're placing the filler in the submass plane, B plane, so along the bone and then along the cartilages, the lateral cartilages in this case. And here you can see that some of the just fresh filler coming through the cannula has a little bit of air bubbles, and that's why we see those little bright white hyperechoic spots because of the, again, we see this contrast and reflection of the ultrasound waves. And we can see this mass plane above it, which is hyperechoic, some vessels in it. So here's the patient images, and here's before and afters. And we use it again for augmentation rhinoplasty, so to build up the nasal dorsum and radix and to elevate the tip. And you can see the results. The other area that we usually do mapping, not necessarily using the ultrasound guided injection, is the piriform space. And I usually do mapping in two planes. Here it is perpendicular to the nasolabial fold, and you can see the facial artery around the mid depth. But obviously, we usually try to avoid the areas where the artery is deep in the bone, especially if you want to do that deep in bone needle injection. And here the ultrasound is oriented along the nasolabial fold. And you can see that as it kind of goes higher, closer to the nose, we always see arteries that dive deeper, and they will be deep on the bone. So we always want to be careful in that area. But sometimes a little bit lower, where we want to inject, we see those areas of the deep blood vessel placement, and it certainly helps us to avoid them and make our injection safer. The other area where I always do the ultrasound guided injection because of the higher risk injections in that area and close proximity to the ophthalmic circulation is the forehead. And then this patient who had multiple previous surgeries, several episodes of forehead fat injections and scarring, and still with some cosmetic deformities. And we wanted to correct those deformities with the filler. We chose to do the ultrasound guided injection again. And here we are placing the ultrasound in the deep plane. And you can see this flashes of color when we inject the filler, and that's because there's small areas of motion and they are registered in the device. So this is one of my favorite sayings. Ultrasound has huge advantages, many advantages, but still we need to know how to use it. So there's a saying by Albert Kligman, a fool with a tool is still a fool. So if we want to use ultrasound, we certainly need to know how to use it. Otherwise, we just need to basically stick to the regular safety protocol and procedures we do. But it is a tremendous tool, and we can really make our injections safer, more precise, and serve our patients better. And especially now, there's a huge growth of the AI models and machine learning, and make actually the learning curve for the ultrasound much easier and help us learn the anatomy easier as well, and do the ultrasound guided injections that can be a little bit different to learn initially and make them easier to learn as well. And then, of course, ultrasound is a great tool for us for the research. So in addition to learning all about the anatomy, it can help us learn about filler and what happens over time, how it behaves in the tissue, and the tissue response, and what happens when patients have complications, and what happens when we treat complications. So again, it's a tremendous tool for our practices. So I would want to encourage you to at least look into it if you have never tried it, and see if you can find it useful for your practices. And this is my talk. So I want to thank you for your attention. There's my email, my Instagram handle if you want to get a hold of me. And thank you again so much.